So we know that digital is transforming how we think about mental health. It's also transforming the membership of our traditional multidisciplinary teams to encompass tech specialists, data specialists, a whole range of new partners. I think it's also transforming how we collaborate internationally as well. And from Mental Health Foundation's point of view, I think it's also driving us to reimagine ethical issues that I think are very familiar to us in the mental health field, but we now need to think through critically what are the implications of the development of digital technologies to support mental health from an ethical perspective. So some of those ethical issues around equity of access, which we've talked about today. It's also about diversity within access and involvement. It's about power dynamics, and it's also about human rights concerns. Increasingly, that's something that I'm really particularly interested and feel that we really need to address within our sector. And when I'm talking about human rights concerns, I'm talking about things like discrimination and stigma, about privacy, control, coercion, and consent, and of course the human right to health. And what does digital do to that human right? Is it an opportunity to progress that human right, or does it compromise that human right? So one of the things I'm going to do today is really just give you an overview of our international collaborations. Primarily that's around a European project that's funded by the Interreg Northwest European Innovation Fund called EMEN. But also I've just come back from 3 days in Stockholm where we've been planning the very first ever digital strand of the International Initiative for Mental Health Leadership in 2018 when we have that gathering. I also want to talk a little bit about the Foundation's approach to mental health. Some of you may not be familiar with us, and again, I think for us it's always about thinking through what is Mental Health Foundation's contribution in any particular arena. So I want to kind of speak about where we kind of come from, our perspective, our model of change. And then I want to, I suppose, to sort of say, like, all of this is pretty much up for grabs. I think our international collaboration work has huge potential for colleagues across the UK. And so one of the things that we're really interested in the principle of co-design is working with all of you to sort of say, these are resources for the UK, how do you want to engage and work with us? So I'm going to talk initially about the Foundation's anchor digital project, which is called EMEN. EMEN has a value of over €5 million, and over €3 million of that is coming from the Innovation Fund. I suppose, like I say, I want to talk about it in some detail because it started last May, and we have it until at least November 2019. So there's a lot of scope for collaboration and thinking through the resource. And certainly we sort of see this as an opportunity not just to collaborate with these member states. It's led through the Netherlands, but obviously we have a number of other European partners, but also to think about how we can grow collaboration between the UK and Ireland, because Ireland is one of the partners as well. And I'm interested in that from the point of view of an all-Ireland perspective. I lead the Foundation's work in Northern Ireland as well as our policy and research work, but also this relationship between the two islands more generally. And with the Interreg funding, all of them have a kind of legacy work package. So one of the things we'll be doing is developing a collaboration platform or relationship. We don't really know what it's going to be in terms of its form or functionality. And so for us, it's really important that we engage all of you and your colleagues, your partners, in this conversation about what might international collaboration mean growing out of the EMEN project. So these are our project partners. I think some of them may be familiar to you. We have Helene Reaper at the VU University. In Belgium, we have Thomas More University, which is kind of like has huge expertise in technological development. In the Netherlands, we have InTherapy, which was the first e-mental health service provider in the world. In France, we have the World Health Organization's Collaboration Centre for Mental Health Research in Lille, and a huge focus there on the involvement of lived experience and human rights and equity considerations. And then we also have some really strong civil society representative and advocacy organisations. So we have DGPPN in Germany and Mental Health Reform in Ireland. And the project's led by ARC, which is really a kind of collaborative of a number of different organisations in the Netherlands who specialise in trauma. And I suppose, you know, with the foundation, our origins are being established after the Second World War in response to the trauma legacy of the Second World War. So for us, there's a great deal of opportunity, I think, to work with ARC and Centrum 45 in particular, who is their post-Second World War element. The foundation and our partners are thinking in terms of quite specific audiences and I suppose partners through the EMEM projects, as well as working across all of the work packages. We lead the communications work package, and within that, I suppose communications is not understood just as being about profile and dissemination and getting the brand out there. It's very much about engaging and persuading and exciting and involving all of these audiences in the idea of digital technologies for mental health. And of course, there's lots of other potential audience as well. So researchers in the academy and outside of the academy, and also journalists. And again, maybe for people who don't know the foundation, communications is one of our particular strengths. So we're the #1 global influencer on mental health on Twitter. 30% of our 3 million visits to our website this year were from outside of the UK. And in November alone, we had 230 countries engaging with our digital platform. So, I mean, our reach, I wouldn't ever underestimate our reach, partly because it's not my part of the foundation, so I'm not claiming anything. But we have a really, really, really strong communications team. And I mean, it's great having Andre here from the mental health, because, you know, he's been a fantastic partner to the foundation in terms of our communication on digital platforms. I'm also sort of saying that as a bit of a kind of like draw in terms of if you want to work with the foundation, communication might be one way that you want to collaborate with us. So in terms of our approach, I suppose I'm really kind of conscious because I'm involved in the NHS at 70 history projects at the moment. So I'm very much anticipating our 70th anniversary next year in the NHS. But Mental Health Foundation is also having our own celebrations, and so we're going to be 70 in 2019. And for all of those 70 years, we've been very focused on the whole area of innovation, on social justice, and on equity. And this model that you see here is grounded in those 7 decades of learning. So like the trials, the errors, and the successes. And this is what we think you need to do if you're actually going to create change in mental health. You need to be involved in policy, research, campaigns. So we run Mental Health Awareness Week each year, really good communications I've spoken about, and then innovation programs as well. So again, there's lots of opportunities to kind of come in and work with the foundation around digital. And then our research strategy explicitly talks about participation, about impact, and a critical approach to evidence that advocates for the centrality of lived experience. And I think for us, it's kind of fitting in terms of this evolutionary moment in mental health that foundation is part of that digital discussion. I suppose in some ways I'm talking about this at length because I'm trying to sort of get us to the point where I'm sort of thinking, well, what is Mental Health Foundation's contribution, but also what when we're looking at the field of digital technologies for mental health, what do we see? And here I'm expressing really the principles of the foundation, and what I'm trying to do is think through how do we read that through in terms of work that we're doing in the UK, but also work that we're doing internationally as well. And I'm also kind of explicit about it because I'm conscious of all the amazing expertise that's in the room. So it's kind of how do we fit within that much broader landscape? And obviously, Andre is bringing people in from beyond the room today as well. So what I wanted to do was give you a little bit of a trailer in terms of what we're thinking about doing, or what we are doing in 2018. So from the point of view of EMEN, in the policy work package, one of the things we're going to be doing is a UK Delphi to identify what are the kind of core policy issues that need to be kind of addressed around development and implementation. And once we've done that, what we'll be doing is running a series of roundtables with our partners, including MindTech, to really progress those policy agendas. In our product development work, we're going to be really focusing around primary care. So we've got a GP survey live at the minute with 1,000 participants as the target to understand what are the issues, attitudes, and adoption of digital within primary care. And then we'll next year be starting the test of Mood Buster in the UK as the product that we're going to try and see how does that run out in the UK. We'll also be having a seminar in Edinburgh in May, and we'll also be doing the UK conference next December, probably the day before or the day after this event. And then finally, I just want to talk a little bit about the International Initiative for Mental Health Leadership. That's going to be running in Stockholm next May. There's going to have a digital strand for the very first time, and our collaborators in that are going to be the research institutes for Sweden and also Trimbos in the Netherlands. And again, that just feels like a huge opportunity to do international collaboration. Thank you.